You may have noticed some of your coworkers getting sick over the past couple of weeks. As we get closer to the middle of fall, that may happen more often as respiratory viruses become more common. Here's Jeremy Baker.
There are 4 common viruses that ramp up in the fall: the common cold, flu, RSV, and COVID-19. And they become easier to contract as we spend more time inside towards the end of the year.
What we're primarily seeing, the number 1 pathogen on our virology report is rhinovirus, which causes the common cold.
The Texas Department of State Health Services Respiratory Illness Interactive Dashboard shows a drop in ER visits from COVID, but an increase in both influenza and RSV through the first few days of October.
COVID has started to decrease some. It's coming down from that summer surge, but there's still a fair amount of COVID out there.
So how do you tell the difference between these illnesses? When it comes to a cold, the flu, COVID, and RSV, they don't always have the same symptoms. If you have body aches, fatigue, and a sore throat but no symptoms, you probably have a cold. If you have those and a fever, it could be the flu. Add in difficulty breathing and a loss of taste or smell, and COVID-19 is a possibility. But if you have wheezing and difficulty breathing, RSV is a high likelihood.
Flu and COVID tend to cause a bit more severe illness. They also tend to have more of the muscle aches, the higher fevers.
For those that have chronic medical conditions, Dr. Bowling says talk to your doctor ahead of time about antivirals you can take if you catch COVID or the flu.
If you do develop severe symptoms, you may be a candidate for getting one of those antivirals that could help you from getting even sicker.
All good information there. All right, 527.